And we have in the last class we have discussed about types of life insurances and this general insurances. So till we have discussed till money back policies, and today we are going to see about marriage endowment policy. So what is this marriage endowment policy? The name itself is telling, right? Marriage endowment policy. Okay, this marriage endowment policy, mainly this provides benefits for us. Okay, mainly this provides benefits from the selected. It will be having a maturity date. It is going to have a maturity date to meet the marriage, and not only the marriage, but also sometimes the educational expenses of the child. It does not only meet the marriage expenses, but also it meets the educational expenses of the child. So mainly what happens in this is the plan is intended. Okay, this plan is intended to help the parents. Okay, when this parents like mainly this government is going to give the scheme, the banks are going to give the scheme, right? So mainly this plan is intended to help the parents to bring up the young children, to manage with their marriage expenses, or to get educational expenses. Mainly this plan this marriage endowment policy is benefited for two, either for the marriage of the young children or for their educational expenses. So next one is unit linked insurance plan. So what is this unit linked insurance plan? So this is having a dual role. Unit linked insurance plan. Here it is nothing but this is having a dual role. One is insurance and the other is investment. Okay, what is it? Insurance and investment. Unit linked insurance. Unit linked insurance is nothing but it is having a dual role. That is of two types. One is insurance and one is the investment. Mainly what is this? This is a combination. Okay, this is a the name itself is telling you linked insurance. Okay, it is a combination of protection and investment. The people, what they do is, if they select this insurance scheme, okay, so what they're going to do is they are going to get insurance with this plan, and they are also going to get the investment. They are going to invest the amount. They are going to invest the amount. If you see here, okay, there, if you take here, when they are going to investment in this scheme, small portion of money here, the small portion of money is invested here. The small portion of money is invested. Some of the amount is going in a securing for their life. Okay, some amount, if they are going to invest the amount, half amount is going into a saving for their life and half amount is being invested in the market. That is nothing but this unit linked insurance plan. Here two types in this unit linked insurance plans. What is happening? Half of the amount is being insurance and half of the amount is being invested in the market. Okay, and here what happens is the policy holders can pay their premium here. How can they pay the amount in this unit linked insurances? They can pay the amount in premium, monthly or annually. Okay, it depends on their selection whether they can pay the premiums in monthly, annually, or monthly or annually. And this is a good investment option. Okay, this is a good investment option. Why this is a good investment option is because they are getting two benefits. One is investment and one is insurance. Okay, and this is a benefit. Okay, this is having a good benefit of tax benefits, having a tax benefit. And when they can withdraw this amount is, okay, in this unit linked insurance plan, when they can withdraw the amount, they can be withdraw the amount when only after 5 years. They can withdraw the amount only after 5 years. That is 5 years period with regular payments. They have to pay their amount regularly. They have to pay their amount regularly during the years. For example, if it is 5 years period, throughout 5 years of period, they have to pay their amount very regularly so that they can get benefit when they are getting this withdrawal time. And next one is keyman insurance. What is the next one? Next one is keyman insurance. One thing we have seen is marriage endowment. The other we have seen unit linked insurance plan. And the other one today we are seeing is keyman insurance. What do you mean by keyman? What do you mean by a keyman? What do you mean by keyman? Anyone? Keyman is nothing but a person highly important. Okay, we will term this key man for a person who is highly important, who is very essential in the functioning of an organization or in a family. Now, like if you take family, who is the key man of a family? Father. Yes, the head of the family. Father is a key man of the family. So here, if we see in an organization, in an institution, who comes under this key man insurance or a key man whom we will term as key man is a person who is highly important or a person playing an important role in an organization or a person who is essentially functioning in an organization comes under key man. So what is this key man? Mainly this scheme, this insurance is designed to financially protect. Okay, mainly this insurance is designed to financially protect the business in the event of death, disability, or if you see in any critical illnesses of such key person. Why they are doing this one? Okay, why they are doing this one is because this plays an important role. If you see, okay, the scheme and insurance plays an important role in the growth of the organization, in the stability of an organization, and in the continuity of the business. Here, what the scheme and insurance says that if a main person of an organization, main person of institution, a key man who is an important man of a organization suddenly falls sick, or he may suddenly get disabled, or he may have sudden critical illness, or suddenly the event of death happens in that person. So what happens here in that situations? There should be some financial protection, right? Because there are so many employees under that. Okay, there are so many working people under that business. Okay, there are so many employees under that business. So nobody should be affected with such type of disability or critical illness of the key man person. So mainly for whom we can take the key man insurances. For example, if you take CEO of the hospital, CEO of an organization, and COO of an organization, and leading sales personnel, who are the leading people or who are giving a leading sales of a personnel, they for them we can take this key man insurance. They are mostly plays an important role, or if you see, they are the important people in the key man insurance. Okay, so here also, if you see in the key man insurance, we have certain benefits. Why we are doing this insurance for this key man is for the financial protection. Why we are doing this? For the financial protection. For whom? To the company. Okay, here we talk about a company or an organization. Okay, if suddenly I said you, if there is any disability, if there is any critical illness, or if there is any losses or deaths, because to prevent all this, so that we will have a financial protection if we take up the scheme and insurance. And also it will help boost the valuation of the company. Mainly it will help in benefit of the company backup. It is nothing like a backup to a company. Okay, this is about this key man insurance. And next, coming to the general insurances. Okay, you have certain general insurances. These are certain general insurances. So what is this general insurance? Are also known as non-life insurances. What are these all? Non-life insurances. Now, till now, whatever we have seen, for example, if you take all this like term life insurance, endowment insurance, whole life insurance, money back policies, marriage endowment, unit linked insurance plan, key man insurance, group insurance. These all are the insurances which are involving the life of the person, which are dealing with the life of the person, which are playing an important role in the life of a person. Okay. So coming to this, if you see, coming to this general insurance, these general insurances are also known as what? Non-life insurance. Okay, these are called as non-life insurances. Mainly what it is doing is this provides, okay, mainly this insurance provides valuables. Okay, the company will provide insurance for the valuables and products. If you see certain products other than our life, previously whatever we have seen are dealing with the life of the people, who are getting the policy benefit. Okay, now if you see in this general insurance, these are, again I'm repeating, it is a non-life insurance. The insurance is being provided for the valuable things, or if you take the products of the thing, and other than a lives. And next, if you see, is it will protect. Okay, mainly this protects against the damage. It protects against the loss or theft of the valuables that are insured. If you see here, motor insurance, marine insurance, fire insurance, health insurance. Now, what are these all insurances? These all is having a valuable insured. The person have to be insured with all this health, motor, marine, and fire. So we are going to see each one. First, if you see this motor insurance, hopefully we all have this motor insurance, right? When you have a vehicle, right? A two-wheeler or a three-wheeler or a four-wheeler, if you take, we anyone, okay, who is having a motor or one who is having an insurance, okay, they are going to have insurance. So what is this person going to do? Okay, the person is going to insurance. Okay, the person is going to have an insurance on the motor. Mainly why it protects you and your vehicle. Mainly what is it? Why we are claiming, or why we are uh, taking this insurance on the motor? Because it is protecting you, and also it is protecting your vehicle against any accident if there is any case of an accident. If you take, okay, mainly what here is examples are what driver license. Yes, driver license is important here. And if you take registration documentation is very important. And if you say updated pollution control, to have this motor insurances, what all documents are needed? The license of a driver, whoever is driving or whoever is handling that motor should have a driving license. And next, the registration certificate of a motor vehicle and updated pollution control certificate. Okay, this all should be having for a motor insurance. Okay, and this motor insurance will help when there is when a vehicle is met with an accident, to claim the insurance on the motor. And next one, if you see, we have a fire insurance. What is this fire insurance? We have discussed in the previous classes also. What is this fire insurance? If you take fire insurance, is what it covers. Mainly it will, the name itself is giving you the answer. Yes, in the motor, it is giving you the answer. In the fire insurance also, it is giving you a answer. Mainly what it is doing here is, it is covering the damage. It is covering the losses. Okay, that is caused by the fire. That is caused by a fire. Mainly this simply covers, okay, mainly this insurance covers the fire related damage. It mainly covers the fire related damage. And next, coming to the marine insurance. So what is this marine insurance? Yes, anyone, what is marine? Anyone, what is marine? Marine is what? Something related or something related. Yes?
Ocean or sea. Ocean or sea.
Ocean or sea. Yeah, very good. Thank you. So here, what is this? Marine is something that is related to the sea, or that is found in the sea. So here till now we have seen all the insurances that are related to the land, and now we are seeing that is related to the sea or water. So mainly it is, why it is needed is, it will provide a safeguard. Okay, it is like a safeguard, or it will provide a safeguard to the assets that are under the sea, or found in the sea. Mainly this will help us to protect our business. Okay, mainly this will help to protect the business, and also this marine insurance will help to recover. It will help to recover the unexpected losses. It will help to for the unexpected losses. If you see here, what are the top providers? Now, if you take who are the top providers for this marine insurance are, like if you see ICICI Lombard and Tata AIG, and if you take HDFC Ergo, and if you take Royal Sundaram. Okay, these are like all this, whatever I have seen, ICICI, Tata AIG, HDFC, and Royal Sundaram. These are some of the top providers that are providing a good insurance for this marine, okay, which are providing for the marine. Mainly this is helping, it is like a safeguard, okay, it is like a safeguard that is protecting the assets, that is protecting the equipment that are important for the functioning, okay, and which is caused, if anything is damage is caused by the natural hazards. Okay, and next we see is health insurance. You all know what is health insurance. In the previous class also we discussed what is health insurance and its benefits. So once again, we'll just have a review of this health insurance. So what is this health insurance? mainly it covers this health insurance. What it will do, it will cover the medical expenses, right? Health insurance, it will cover the medical expenses of an individual. So what will come under this medical expenses? Yes, what comes under medical expenses? Medical bills, what all will be the medical bill?
Hospital bills, all the pharmacy
Hospital
bills,
bills,
surgery bills,
surgical bills, very good. Any bills related to surgical, bills related to medical? Yes, medical tests you will be
pharmacy
going.
bills.
Yes, pharmacy bills, doctor visits.
Right.
We will be consulting the doctor, right? So you are going to have some doctor visits. For that, you are going to have. So these are all the medical expenses. When a person is visiting the hospital, our patient is when a person is visiting the hospital, there are so many expenses. We can't say, right? Because once the person just goes to have one consultation, person goes to have a visit to a doctor for a general checkup or something like that. But sometimes unexpectedly the patient have to go for the other checkups. The doctor may not follow only the routine checkups, but the doctor sometimes, depending upon the condition of the patient, uh, write or prescribe some special investigations also sometimes. So this all comes under the medical expenses. So what are the advantages of this health insurance? So what you think, what are the main, because mainly it is protecting, okay, this program, this health insurance policy or this plan, mainly it offers a protection against the medical expenses, because you know how much the hospital bills are, or how much expensive the hospital charges are, right? So here mainly because of that, and for the critical insurances, okay, you will be having like critical insurances protecting policies, and they also cover against like life threatening diseases like cancer, okay, like kidney failure, or the person undergoing for bone marrow transplantation, and the person who has met with an accident and lost his limbs, either it may be upper limbs, two hands, or lower extremities, legs, two legs, okay, lost the limbs. Either the person may lose his legs or hands. Okay, in certain conditions, these are the life-threatening diseases like kidney failure, okay, carcinoma, that is cancer, bone marrow transplantation, and so many other life-threatening diseases. So for this life-threatening diseases, this critical insurance, this health insurance plays an important role in the individual life who is claiming or who has been experiencing this medical expenses. And next coming, most companies offer nowadays, if you see what is happening in the hospital, most companies offer cashless claims, right? Cashless claim facility. Just you go, you just give your health insurance details, whatever the ID number you have, whatever, wherever, whatever the details that are required. If you just tell the details, just they will enter the details, and what happens, you can receive a good treatment in your hospital wherever you are going in, and you can have a best treatment. So mainly what is the benefit of this health insurance is most of the companies, they are offering the cashless claim facility. And one is what, no out of pocket, we are not taking any amount from our pocket, and we are paying for a medical expenses only with your one ID, with your only with your health insurance, your you can take the treatment from your hospital. And next thing is the expenses, whatever the expenses that have been like generated during the care of the patient, okay, these expenses are settled between the insurer and the hospital, the one who is giving you the insurance, and the one who is providing the medical care, that is nothing but your hospital. So this two people, that is the health insurance policy, the one who is giving you the health insurance, that is the insurer, and the hospital, so they both settle whatever the expenses that have been generated for a patient. And next one is what, healthcare, or it also plans, or it also provide you one benefit, that is tax benefit. Already we have seen in the previous classes. And next one, if you see, like it can also give us a good opportunity, or this health insurance gives a best opportunity for the patients, like to get a quality healthcare, to get a quality healthcare services in a corporate hospitals or a well reputed hospitals. Okay, if the patient is having this health insurance, the patient no need of going to a government hospital or a clinic for a life-threatening conditions. Okay, the patient may go, visit KIMS hospitals, Yashoda hospitals, Apollo hospital, care hospitals, etc. So the patient or the person can nicely access the good quality of healthcare services whenever if he's having this health insurance. And next one is what it also covers, like alternative treatments. Okay, sometimes, as I said, in the beginning, like unplanned treatment. Sometimes we visited the patient visits the doctor for some investigation. After visiting for some complaints, after seeing the complaints of the patient, what the physician will do, what the doctor will do, he will plan some other investigations which were not under the plan previously. Okay, but after seeing the complaints of the patient, after listening the complaints of the patient, after doing the physical examination of the patient, the doctor needs to do some other investigations, or else he want to plan some other treatment for the patient. For such unplanned treatments also, this health insurance is benefited. And next, if you see, safety is also one of the important factor that plays important role in the health insurance. Okay, because if you see now, there is a very rise in the medical cost. The medical costs are very increased, where a common people cannot come to the private hospitals or to the corporate hospital, and they can afford the amount that is there. But with this health insurance, what they can do, they can afford the prices with the help of this health insurance. Okay, and next, with this health insurance, what is the other benefit? It is like a safeguard for our family, right? Whenever if a person is taking this health insurance, it is like a safeguard our family, and it is also protecting our saving. Yes, when you have some amount for your saving, when you have some bank balance for your saving. Okay, and when a person is fallen sick, he's not using the saving amount, right? He's not using his saving amount. What he is doing, he is just claiming his health insurance. So with this is also one of the benefit, where he is not using his saving amount, he is protecting his saving amount, and he is utilizing this health insurance amount. Okay, understood till now? Yes, this is about your motor insurance, marine insurance, fire insurance, and health insurance. This all insurance comes under this general insurance, which are not dealing with the life of the person, right? Which are not dealing with the life of the person. Previously, if whatever we have seen, where everything related to the securing life, okay, they were related to the securing life of the person. And next, if you see, yeah, this already like we have discussed in the last class. Next, we will see like principles of insurance. So, what are the principles of insurance? What are the foremost thing, or what are the main important things that are important in this insurance? Okay, before like in this principles of insurance, what is this insurance? We have discussed what is this insurance. It is like a contract. Okay, this insurance is like a contract between the insurer and the insured. It is between the company and the one who is involving in the contract, is like a is the simple meaning of the insurance. So this contract, okay, this contract have certain principles. Okay, just like that, you cannot get into insurance, and you cannot just get the benefits of that insurance. So we have some requisites. We have some requisites where we have to follow during this insurance contract. It may be like 5 years, 10 years, 15 years, 20 years, 30 years. We have seen in the previous classes, right? So throughout this like contract, we have to follow certain requisites. So what is the first one is offer and acceptance. Yes, offer and acceptance. What is this offer and acceptance? The both groups should accept, or the acceptance should be between the insurer and the insured regarding their offer. Okay, when you get into a company, right? When you get into a company, what do you do when, for example, if you're just working for an interview and you have selected in the job? What do you do? What do you get?
You get paid
Yes,
for it.
yes.
You get paid for it. I mean, like salary
Okay,
and
yeah,
something.
you will get paid for it. Okay, before that, what do you get? Offer letter, right? You will
Offer
get
letter.
some
Yes.
offer.
Okay. To join.
Yeah. So you will be getting some offer letter. Okay, first most thing. Once you are like your contract, your deal is okay. Okay, you gave a very good interview for your company, and they appreciated your efforts during the interview process. And what do they do? They accept you. Okay, chalo, we will take this person into our organization. We will take this person into an institution. So they will accept you. And what do? They will offer you, right? So that is the thing here. Same in this insurance also. They should be an acceptance. They should be an acceptance between the insurer and the insured, who is related to the offer or whatever the offer they are taking. So previously we have seen all certain insurances, like so many insurances. It may be any one of the insurance. And the second one is considerations. Considerations are also very, very important in this insurance, principles of insurance. So what is this considerations? The premiums. Okay, the premiums, the future premiums that you have to pay, right? You have to pay, right? Simply you will not get the insurance policy. People will not simply give you the amount. When they will give you the amount, if you are paying the premiums, okay, it may be a present premium or it may be a future premium, then only you will get a good benefit from the insurance company. So that is the consideration. So the consideration is nothing but the premium, the present premium or the future premiums that you have to pay to the insurance policy. That is about that is a contract. Okay, you are making a contract. Chalo, I am going to pay this much of percentage and you are going to give me this much of amount during my insurance. So that is a consideration or a promise that you are making between the company. Okay, between the company. It is like a contract. You are making an insurance contract, or you are making a promise that I am going to pay the premiums. That is the considerations. And the second and the third one is like a capacity to control. Okay, what is this capacity to control? Any idea? Capacities to control the bond. Okay, when you are creating a contract, when you are just creating a contract, or when you are just contracting between the two parties, okay, they both should have a legal capacity. Okay, legal capacity of a contract, like how the amount of risk and insurance can be claimed. Okay, for example, the amount of risk and insurance can take on behalf of an insurer, like how much insurance an insurer can offer, how much. Okay, a legal acceptance or a legal what is it, a legal control should be there between these two groups. And next, prior consent also should be there between these two parties. A mutual understanding should be there. A mutual constant prior a bonding should be there between these two parties. Trustworthy bonding should be there between these two parties. Okay, and the other one is legality of object. What is this legality of object? The purpose of the agreement, okay, which you are making should be lawful. Okay, mainly, for example, whatever the insurance you are claiming for should be a lawful property, or it should be a property that is legal, or it should not be it should not be illegal. For example, if you are stolen the property from some other person and you want to claim an insurance on it, is it liable? You have stolen some property from some other person and you are claiming an insurance on it, you want to have some benefit on it, can you get that profit
No,
from that?
no, never, because it is
No.
illegal to acquire
Yeah,
the
because
property.
it is illegal. So this insurance people, this is one of the principle of insurance. So here what happens is, so the agreement which you are making, the both parties which they are making, that is insurer and insured person, the agreement should be lawful. Okay, whatever the if a motor bike is there, you have stolen for some other person, the what is that? The driving license is related to someone, what else? The pollution control certificate, whatever that is related to someone. Okay, the registration certificate related to the documents, everything is related to someone, and just you're taking the vehicle and submitting the details and asking for the insurance. Will the insurance people claim? No, they do not claim. They check for the legality of the object, whether it is legal or not, whether it is lawful or not, whether we can take an agreement with this object or not. Okay, if it is a stolen property, never. No one can opt for the insurance. Okay. And next here, if you see some of the important principles apart from this are utmost good faith. Okay, what do you mean by utmost good faith? What do you mean by faith? Yes. What is faith? General,
Being
simple
true.
word. Very good. Being truth, honesty, loyalty.
Honesty.
Yes, this all comes under, right? What? Good faith. So here the insurer and the insured both, okay, the insurance company and the one who is opting for the insurance, they both must have a transparent and a good a good disclose should happen between a okay, disclose whatever the documents that have been sharing, the important information that is required before signing the insurance policy. Everything should be transparent and everything should be disclosed properly, whatever the documents that are needed before you are signing your insurance policy. All the documents should be what transparent, like it should have a good faith. If you are submitting the documents which are fake, then it is not transparent and that does not come under the utmost good faith. So here main thing here is your honesty, the loyalty. Mainly this refers to the principle of a good faith in the insurance, and this is also like we call like it is an important right. Okay, this is an important right for us to prevent from cheating. Yes, when you submit all the documents which are fair enough for your insurance policy, what happens? There is no cheating. You will not be cheated. Yes, you will not cheat others, and the other people also will not cheat you uh, regarding this insurance and all, right? So this is one of the thing where we can prevent being cheated being cheated and cheated by the company or a policy. So all your documents or the things that you have to give, the information, important information, should be disclosed. It should be disclosed enough properly in a honesty way or in a loyalty way. For example, if you are applying for an automobile insurance, just now I said you, right? So if you are applying, just now we have seen motor insurance, right? So we have to, for example, if you are applying for a motor insurance, so what you will do, you have to submit all your essential documents. Okay, you have to disclose all your documents which are related to your motor vehicle. For example, previously, if you have any accident history with that vehicle, even that documents also you have to submit. Okay, whatever happened. Okay, if there are any traffic citations, okay, sometimes we will not keep helmet. Yes, we don't keep helmet and we just cross the signals. This all comes under the traffic citations, right? So when all these details should be submitted in the motor insurance whenever you are submitting it. And also, for example, health issues. Okay, what, for example, if you're taking a health insurance, what all you have to submit? Anything we have to submit? Yes, we have to submit, right? What you have to
ID
submit?
proofs.
Yes.
Our ID proofs you have to submit at Aadhaar, and also
Yes.
you should not have any previous history of other diseases.
Very good. So we should not have previous. So if you have any previous history of diseases, if the patient is having any previous history of other diseases also, they have to submit that documents also. Whatever the previous medical documents were there, they have to submit that documents also. Okay, so this comes under your what? Utmost good faith. Okay, the name itself is telling utmost good faith. Okay, you should be the both. Okay, the both who are the insurer and the insured, they both should be transparent and they have to disclose all the documents which are honest and faith and which are all, it comes under the legal documentation. And next comes your representation. So what is this representation? The details that are collected by the applicant. Okay, the details that are collected by the applicant. So what details, for example, now, as you said, okay, for any insurance, when you are going or when you are claiming any, when you're getting into an insurance, what do they ask? Where do you work? Yes. What is your income? What is your age? Yes. This all details are very, very important in this representation. What is the profession of the insurer? What is the income of the insurer? Insured person. What is the profession of the insured one? What is the profession of the income? What is the age? What is the family history? Who all comes? How many members are there in the family? What is the health condition of the family members? Okay, what is the general condition of the person who is taking the insurance? Okay, whether the previous, now as we discussed, right, whether any previous medical reports are there. Okay, so we have seen till what representation, right? So all these details have to be submitted, like your profession of the person, income, age, family history, the general health status of the person, and the medical reports, whatever the previous medical reports that are there, whatever that matters relating to the conduct and the character. Okay, relating to the conduct and the character. Or if any criminal records are also there, the person have to submit for their insurance policy, so that it can be avoided during their things. And next one, if you see, we have assessment of severity, like how we can assess the severity of risk. Okay, and how we can like truthfully disclose such type of risk. So in that, first one is what? Breach of warranty. Okay, what is this breach of warranty? Is it is nothing but like, it is like a legal commitment. It is like a legal commitment. So what in simple word, if we take what is this breaches, it is a failure to do. It is a failure to do what is to be required by a law. Okay, it is like a failure to act. You can also tell like a failure to act in a required or a promised way. That is, you are breaking your promise. Okay, simple thing is, you are breaking your promise. You failed in your promise. You're not doing whatever the promise you have given to the opposite person. That is breach of warranty. Okay, so legal commitment. If you are breaking that commitment, it comes under the breach of warranty. Okay, that is this why, that is we have to assess, because it breaking a commitment, failure to act, okay, and just breaking your promise, okay, it creates disturbance in your contract, right? A contract of insurance. So that's why. And main thing, for example, I'll give you one example. If you see, like two companies are there, okay, like two companies are there, like A and B. Okay, so A and B. So A agrees to deliver. Okay, A agrees deliver. For example, A and B is there. Not two companies. If you take A and B, A is agreeing to deliver some 100 packets of sugar. Okay, it is willingly, it is coming forward, or it is accepting to deliver how many packets? 100 packets of sugar. At what price? 50 rupees. Okay, per packet is 50 rupees to person B, to person B. So finally, what happens during the delivery time? So what is their commitment? What is their promise? What was the promise? To deliver 100 packets of sugar, right? For how much price? 50 rupees.
50.
But finally, what is this person doing? The A agreed and he just broke his promise, or just he failed his promise by delivering the second quality of sugar. Okay, second quality of sugar. He delivered 100 packets, but the quality was low. Okay, instead of giving 50 per packet, or whatever the quantity, so how much he gave is like 40 rupees. Okay, he was taking money. How much he is taking? 50 rupees only he is taking. But what quality he is giving? 40 rupees quality, 30 rupees quality he is giving. Is it a good thing? It is a good contract that they both are having? No. Yes, the A person or a A, what happened? He just failed his promise. Yes. So what can this B do now? What can this B person can do? He can just avoid the contract. No. the contract which was between us was 100 packets, which was of 50 rupees 50 rupees quality. But as you are giving me like a low quality, I will not go with your contract. I just want to end up this. So this is about example of your breach of warranty. Okay, failure to act. And next, if you go, for example, the other one is like the statements which are submitted. Okay, you will, for our insurance, for our health checkup, for example, we will take a health insurance. When we are submitting few documents, all the documents, the statements should be true, right? The statements should be true and it should be valued. Whatever the regular health checkups you are doing, okay, related, everything should be valued. If you are submitting the wrong information and all, you will, the person only will fall under the risk. Okay, severity of risk. And the next one is insurable interest. What is this insurable interest? So in insurable interest is what the investment. Okay, mainly what happens is the investment protects anything. The investment protects anything subject to the financial loss. So mainly here what you have to understand is capable for being insured. What is insured? We already seen in the previous classes. What is insured? Insured and non-insurable we have seen. Insured means what? The company will give you the insurance. Yes, the main capable for being insured against when you are having any loss, when the person is having, organization is having any loss, any damage, any debt, they will be just insuring the policy. And mainly the policy holder should buy the property insurance. For example, if you just take here the main insurable interest, for example, I'll give you one example. That is, two sisters are there in a family. Okay, two sisters are there in a family and they are purchasing a house. How? Co-purchase. It is a co-purchase. Okay, they are purchasing one house. Okay, they are sharing the amount and they are purchasing one house. So finally, when it comes to the property, how much they are investing? For example, if it is 50 lakhs, if it is 50 lakhs, or else you take 1 lakh, if it is 1 lakh, one sister is going to invest 50 lakhs. Yeah, like 25, right? 25 lakhs they are going to invest. So who is going to have that, insurable interest? Who are going to get it? Who will get insurable interest? Both will get, because they are having how 50% investment is done, right? 50% of investment is done. So they both are going to get the insurable interest. And next, if you see the other example, like if a person just buy a property, okay, own house, own property, he is having his own house and he is like buying insurance for that property, but not his neighbor's property. Now you have side by side houses, right? Yes, you have houses that is like attached to the other house, nearby houses, your neighbor houses. So how you will take the insurance? Will you take insurance for your own house or you will take insurance for your neighbor's house also? You will not take for your neighbor's house. But sometimes what happens? A person does not have an insurable interest. If there is any financial loss that is arising from the damage of the neighbor's house, if there is any damage from the neighbor's house, if there is any damage causing by your neighbor's house to your house, then this insurable interest is not claimable in this insurance, or it is not claimable in this interest. Okay, that is one example. So why do we need this insurable interest? Main thing is to prevent the gambling. Yes, main thing is to prevent the gambling. We will just avoid, or we will just have to follow this insurable interest. Okay, and there are certain insurable policies. Okay, there are certain insurable policies that are taken basis on the insurable interest. So first, if you take is employer and employee. You all know what is this employer and employee, right? So here what happens, an employer can buy health insurance coverage. An employer can buy health insurance coverage for all his employees. Why? For time pass. Yes. Why will an employer spend so much of amount for his employees? He is buying health insurance coverage because the company, the organization is having lot of amount, lot of money. No, it is not like that, right? Why? Because and as employees having difficulty, yes, recovering from the sickness may lead to extended financial loss to the company. Okay, for example, what is happening now? There is one trick of the employer. If the employee is simply getting falling sick and he's been having an extended financial loss. So this employer, because as he is buying an health insurance coverage for his employee, employer, the employee is getting the benefit for his financial loss. Whatever the financial loss is there, he is been benefiting with this. And what happens? As an employee, your absence can cause loss to the company. If simply you're getting absent, if you're simply getting absent, or if you're simply getting not coming to the work and the work is not done in an organization. So what is this all creating? It is just creating a loss. It is creating a loss to the company. So what this employer will do, they will buy a insurable interest, or they will buy a health insurance coverage for all the employees for their benefit and also for the organizational benefit. And next one is the creditor and debitor. So what is this creditor debitor? So this creditor can take out a policy. Okay, he can take out a policy on debtor's life for protecting against any possible loss. This is clear cut. And next here, mainly if any loss is there, any possible loss is there, this creditor can just claim, or just can claim the amount for their protection. And next is partners. Now, who are these partners? Partners in a business. You have business partners, right? In an organization, you have multiple partners. So these partners can also purchase a what policy on life of the other partners, because as they are like together working in an organization. Okay, it is like same like in the previous thing we have seen. No, just a minute, I'll tell you. Somewhere we have just come across this point in the benefit. So here, what it is doing is the partners. So what happened? What happens is the partners in a business, just they will claim the policy towards the other life of the partner's life, or the other partner who is included in the organization. And next one are the guarantors. Who are these guarantors? These guarantees are the one who will pay the borrower's debts if they are unable to pay the loan obligation. Okay, they can de-opt on a loan obligation. So these guarantors can take a policy on the life of the debtors. Okay, mainly why? Because it will be liable to pay in case of death of the debtors. Mainly here, what they are doing is because it is helpful in the payment in case of there is any debt or death of the debtors, it is liable for the guarantors. The guarantors have to borrow, or they have to pay the debt of the borrowers who are just in the middle. Sometimes they will not pay the amount, or sometimes what happens is because of death they cannot pay it. So the guarantors have to pay the policy. And next one is subrogation principle. Now, what is the subrogation principle? This subrogation principle, it is a legal right. What it is? It is a legal right of an insurance company. Mainly here, what they do is they will recover the amount. What they will do? They will recover the amount paid as compensation from the person. Okay, what they do is the amount paid as compensation from a person responsible for the insured loss. For example, if you take like it is a practice, substituting practice, okay, for the another legal setting. It is a legal right for the third party. It is a legal right for the third party. So here I'll just give you three things. Okay, here in this subrogation principle, there are three parties. One is insurance company, one is insured. I don't know, just a minute. One is insurance company, one is insured, and the other one is party responsible for damage. Party responsible for damage. Now, this party responsible for damage will be the third party. Okay. insurance company, insured person, and party responsible for damage. Party responsible for damage is the what? Party responsible for damage is what? He is the third party. He is the third party. Compensation. Here we are taking a compensation. For example, we will take two people. Okay, I'm giving you a good example where you can understand very clearly what is the subrogation principles. Please listen to this example. It will be benefit for you. If you take two people called John and Sam, okay, we will take these two people called John and Sam. These two are both friends who are just traveling and just involved in a car accident. Okay, they are involved in a car accident, and it is a John's car. Whose car is it? It is a John's car. And this car, now John's car is severely damaged. Okay, John's car is severely damaged and it requires 1 lakh. How many lakhs for the car repair? For example, I'm telling you, okay, I don't know whether it will cost 1 lakh or not. Okay, we will take 50,000. Instead of 1 lakh, we will take 50,000. Okay, so this John car is severely damaged. Okay, and 50,000 is costing for the repair of the vehicle. So what happened? Luckily, John has insured. Luckily, John has insured for that motor insurance. He took a motor insurance for his car. And what happened finally, because he's so lucky, because he's insured in that thing, what he did is full cost. Okay, that is 50,000. The full amount has been recovered. Okay, for his repair throughout through an insurance claim. After the accident, he just claimed for an insurance, and 50,000 is been like recovered. Okay, full amount is been recovered. So finally, what this insurance people will do? Blindly, they will give you insurance. Blindly, they will pay this 50,000. Please say yes or no.
No, ma'am.
Blindly,
First they come for a checkup. They come and check.
yeah, very good. They come and
So that
check. They will do investigation, right? They will come.
investigation.
They, for example, at that time, at that sort of time, they may pay. Okay, to clear. So that because the person was paying an insurance, so they just want to help that person who is claiming an insurance. So they will just pay the amount and just they will clear and they will recover the amount. But finally, eventually, what they do is they also investigate. Okay, they always investigate what happened, how happened, whether this is truth or not, whether this is honest or not. Okay, so what do they do is here the investigation. When they do the investigation, for example, they came to know who was traveling in a car. John and Sam was traveling. It was a John's car. And finally, what happened is Sam was responsible. Who was driving a car? Sam was driving a car. Okay, when he was driving a car, he is responsible for an accident. Now, this Sam is responsible for an accident. Why? Because the speed. Because he has exceeded the speed limit. Because he has exceeded the speed limit. So, what happened? The car has met with an accident. The car has met with an accident. So because of this, what happened is now this John's insurance company that is there. So what do? They will decide now. Okay, they will decide. Okay, they will take out all the, what do you say, like they will take out all the proofs and all, and they'll go to the Sam and they'll collect the amount from Sam, stating that you are a cause for the damage. You are a cause for the damage as we have already paid for it. So this Sam, what he have to do now? He have to pay for the insurance company. Now this Sam have to pay for the insurance company. So this is one good example of your subrogation principle. Okay, what we are doing is here. Now, for example, I said you three parties, right? What was the three parties? Insurance company, insured company, and third party. Who is the third party? Party that is responsible for the damage. Party that is responsible for the damage. Understood? Did you understand
Yes,
that example, Ma? Yes. So here, these are the three things. So now you tell me insurance company. Okay, if you take the example which I've given you now, who will come under insured? John or Sam? Who comes under insured? John comes under insured because he's taken insurance Claim, right? He took an insurance for his motor vehicle. John. Now, who is the party responsible for damage? John is responsible or Sam is responsible?
Sam is responsible.
Sam
So
is
he will be a
responsible.
third party.
Yeah, so this Sam is responsible because of his driving, because he has exceeded the speed limit. He is the third party responsible for the damage. Now, this is the example of your subrogation principle. Okay, next coming to the, no, what is the time? Yeah, 7:05. We will just see this one example and we'll end the class. One is contribution principle. What is this contribution principle? It comes into action. Okay, mainly contribution principle is it comes into action when you have taken more than one insurance policy to cover the same event. Now, what happens? I'll give you one example. For example, couple is there and sudden he is having two health insurances. How many? Two health insurances, like providers, if you say A and B. Suddenly what happened is couple has met with some illness, sickness, and he has been admitted in the hospital. So what he did, he claimed insurance from one company. How many insurances he is having? Two insurances. He is having two insurance. Health insurance, he is having two. But finally, after falling sick, after he is hospitalized in a hospital, what happened is his his total coverage bill was like A company was giving 5 lakhs and B company was giving 5 lakhs. So finally, when he is admitted in the hospital, the claim was 2 lakhs. How many? How much amount? It was 2 lakhs. So what will this couple have to do? So couple decided to claim the policy. So he went to A. So this A party, A company, what they did, they checked everything and they came to know that it is utmost trust, utmost faith. Okay. So everything is transferable. He's sick, his good treatment and faith treatment is given in the hospital. So finally, they will just release the amount. They will recover that 2 lakhs of amount. Now, this fellow, what he will do now? He will go to B company also. Okay, he will go to B company also. And what he will do is he will ask for a claim. Okay, he will again show all these documents. I was admitted, I was sick, and I want this 2 lakh rupees. Is it fair?
No.
No, it is not. And so this person is not eligible like that. Okay, he will get insurance. He will get insurance only from one. Even though if he is having two insurances also, he can use only for one time. That is only for one time, in the sense if again if he is affected with any sort of illness for the second time, then he can claim party B. For example, first time, now this time he's in 2021. If you take, when he was sick, he can claim the benefit of A. If in 2024 again he is sick now, okay, after so many years he's been hospitalized, now what he can do, he can take the benefit from B. It is not that you cannot take, but at a time you cannot take the benefit from A and B. That is your example, that of contribution principle. Okay, and next one is what? Proximate cause. What is this proximate cause? It is nothing but a close, immediate. Okay, it is a close, immediate. Okay, this is very, very important, and which helps, this proximate cause will help us to decide how is the loss and how did the damage happen. Yes, for insurance, it is very important, no? Because this is the principle of insurance. So as we discussed, insurance people will just, insurance company will just like that, they will not give you the amount. Okay, if you submit all the documents also, they will do the investigation. They will decide, okay, they will check how did the loss happen. Okay, when did the loss happen? How did the damage happen? Okay, they will check each and everything and then they will recover the amount. So here, coming to the proximate case, what happens here is, here primary events. Main thing you just remember, or if you have any pen, pencil, book or whatever, you please write primary event, because that is a main point for proximate cause. So what are the primary events or series that happen or that is helpful for an insured loss? Now here, for example, I'll give you an example here. A truck driver is there. Okay, a truck driver is there or a lorry driver is there who is driving on a road and he has just hit a car. The lorry driver hit a car. What happened now? Who is the cause for an accident here?
The lorry driver.
Very good. The lorry driver is the cause of the accident. But what made him to do the accident? Yes, something made him to do the accident. It is not that he is not conscious, or he is not. It is not that he is wrong. Because of some reason, because of some situation, because of some series, it made him to do the accident. For example, okay, child moving. But what happened behind the scene was, now we have seen primary event. That's why I said you proximate. P for proximate, P for primary cause. Okay, P for proximate, P for primary cause. So here is what is the primary cause now was to avoid a bicyclist riding. Okay, because a bicycle came. Okay, a bicyclist, a child just came across him, and the bicyclist was driving unsafe. A child who was driving a bicycle, he was driving very unsafe. Okay, because of that, what happened? Because of that, what happened? The lorry driver had to hit a car. Understood, ma? The lorry driver had to hit a car. So now here also, who is the third party? Or a third, yeah, we have discussed here, no? Who is that party responsible for damage?
It is a lorry driver.
No, no.
It's responsible for
part.
driver, no ma'am.
Bicycle. No. You understood? It was not intentionally, right?
Yes,
This
yes.
truck driver, this lorry driver did not hit the car intentionally or with unconsciousness, or it happened just to save the bicyclist. A person was riding a bicycle, and the bicycle person was doing an unsafe driving. So what happened here? To escape from this person, to save this person, to avoid this bicycling riding, what this lorry driver did is he just, without his like awareness or whatever you say, he just hit the car. Understood? So that is proximate cause. Now, what is the primary cause here? Yes?
Sorry, ma'am. Sorry to interrupt. But here, who would be compensating for this act, ma'am?
No, bicyclist. Primary event. Okay. Now, what is it? This is a primary event. Yes, when I was discussing this primary case, I said you, okay, what is this? That's why I said you to just note it down. P for proximate, primary event. So here the series, what are the primary event series of events? Now, what we do when we are just traveling on a road, we just blame that lorry driver, right? We don't know. If that person tells also, we just don't mind him and we just go back, shout, and just be back of the lorry driver. But when this insurance people, now when it comes to the insurance people, now what do? They search the CCTV cameras, right? So when they see this cameras, when they see the evidence, when they do this investigation, when they do all this, apart from that, they will come to know what is the primary cause. Now, what is the primary cause here? Because of this bicycle driving, this lorry driver want to save that person, and he just made a damage to the car. So that is a proximate case. Understood, ma? Primary event or series of event?
Yes.
Yes? Yes. So we will just see this one thing and we will end up. Okay. And tomorrow we will go into other topic, that is demand and supply. So for now is principle of loss minimization. Principle of loss minimization. Sorry. Principle of loss minimization. So what is this principle of loss minimization? The thing is to reduce the amount of losses by the policy holder. So now, for example, if you take this point, this principle, it involves implementation. Mainly, it involves implementation and following the measures. Strategic planning is important for this loss. The name itself is telling loss minimization. That means we are doing something to decrease the loss. We are taking some measures to decrease the loss. Okay. Severity of loss. For example, promoting healthy lifestyles, right? Now, When you go to watch a movie, example, when you go to a theater and watch a movie, what is the first thing you get on a screen? Something you get, right? Advertisements. Do you get some advertisements on the screen?
Advertisement. Yes.
Yes,
Smoking?
Mostly
Mahesh
on
ka
the
advertisement.
tobacco.
Smoking advertisement you get, right? Smoking
Yes.
is injurious to health, it causes cancer, and some
Cancer.
role play is done, right, in that advertisement. So here what happens is, it is a example which I'm giving you for loss minimization, for promoting the healthy lifestyle. So what is it is that advertisement is giving you a health education. That advertisement is promoting a healthy lifestyle so that people will just get some awareness out of that advertisement. It is nothing but principle of loss minimization. Okay, it is the principles of loss minimization in the healthy lifestyle, to promote the healthy lifestyle. Okay, now one another example is like we have vaccinations. Now we'll take polio. You know polio vaccine?
Yes.
Recently the children's got this polio vaccine, right? Some last month. So why
Jan.
do we give this vaccine? All the children are
Prevention is
affected
better
with
than
polio.
cure.
That's why we are yes. To
Prevention is
prevent.
better than cure.
Very good.
That's it.
Prevention is better than cure. So for prevention, so we are taking certain measures now. This also, okay, giving this pulse polio program, conducting a pulse polio program, giving this pulse polio vaccine. What is this? This all comes under this loss minimization. We are preventing something. We are implementing. We are following certain measures. We are following certain strategies, and we are seeing that the frequency of losses decreased. We are seeing that the severity of losses decreased. So, for example, if you take installation, you know what is installation of fire? Installation of fire alarms. Last time also we know. For example, you take a clinic, you take any organization, you take any what is that institution. For each and everywhere, you have this fire extinguishers, you have fire alarms, you have a fire sprinkling system, right? Whenever there is some fire, water sprinkles out from that system. Yes or no?
Yes, ma'am.
Yeah, and you have some secure doors and windows. Whenever there is a fire, you have a return code over there. Like in this door is used in case of fire.
Fire.
So what is that all now? Prevention. It is a prevention we are doing. That is loss minimization. We are doing all these things to reduce the damage. We are doing all these things to reduce the loss. Understood, ma? So regular maintenance, regular checkup. Okay, this all will help us to minimize the loss. This will help us to minimize the damage. Understood? Yes. Yes. So this is about your principles of insurance, and tomorrow we will go into a topic. I hope you have understood well with these examples. Yes, because I've
Yes, ma'am.
selected few examples so that easily you can now. For example, for this proximate, if you take one simple example, that is what? Primary event. Okay. The scene is something, but the primary cause is something. So we should know what is the primary cause. Okay. And in contribution principle, we have seen a couple example, right? Couple taking two health policies, and he want to claim two policies where he cannot do. He can only claim one health policy for one time. The other year, once again, if he is sick for third time, fourth time, the other years, then he can claim for it. Okay, in the contribution principle. And next in what is that? Subrogation principle, we have seen an example of this two friends, John and Sam. Okay, this was also somewhat interlinked like a proximate case because third party. Okay, three principles, three parties we have seen here: insurance company, insured person, and a party responsible for the damage. Yes, thank you all.